Shortly after rescuing a dog from China, Kate and Jay discovered Otis had joint problems, including hip dysplasia, which greatly affected his mobility and his quality of life. None of the previous treatments seemed to help, so they decided to try one last thing: stem cell therapy, which uses the body's own tissues to restore damaged joints and limbs.
Okay, let me see it.
With the stem cell therapy, we know that it's a fairly new procedure, but we're super excited about it because it's non-invasive. It's taking stem cells from his own fat and just being re-injected into his body. The worst case scenario is that it doesn't work and Otis is the way that he is now. So there was no risk factor, which excites us, and we know that it's something we could chance.
We only use adult stem cells from the same dog going into the same patient, so there's no chance of side effects or rejection. Okay, so it's it's a perfect kind of treatment. Can't do any harm. It's going to do a lot of good. A doctor's dream.
Although Dr. Sjonnesen and his assistant Sarah Barger are confident that the surgery will go well, Kate is nervous and anxious when they take Otis in for phase 1, the removal of the tissue.
They undergo a short anesthetic to collect the tissue, to collect the stem cells, and so ahead of time we need proper diagnostic workups with blood work and x-rays to make sure it's safe to do that. And other than that, no risks. We see like a lot of practices have a lot of patients that are mainly large breed dogs that undergo osteoarthritis, degenerative joint disease of those joints, their hips, knees, elbows, and shoulders. Now that can be partially genetic. There's also small dogs that have osteoarthritis that we can certainly benefit for, and cats as well. Although cats' osteoarthritis is not nearly as common as it is with dogs.
In the meantime, Dr. Sjonnesen is carefully stitching up the incisions.
So the surgery went fabulous, as expected. A short procedure to collect the fat tissue from behind the shoulder, and we've closed up that incision now, and Otis is waking up.
Hi, sweetie. Hi. Hello. Hello. I know. Did you do so good? You did so good. I'm right here. Yeah, I'm right here. I know.
The second phase starts with preparing Otis for another procedure, which consists of carefully injecting the stem cells into the damaged hip areas.
He will, later today, after his injection in his joint, he will go home, and then he's going to be on some anti-inflammatories for 4 or 5 days. And then it's going to be, 15, 30, 60 days before the actual stem cells get in there and do their job.
We caught up with Kate and Otis after the surgery to check in on his progress.
It's been 2 months. Otis is doing amazing. We're super happy with the results. Once the anesthetic wore off and the incision started to heal, we really started to notice that his hips were stronger. He was able to sit longer for us, and there wasn't as much crunch and snap, crackle, pop when we hoisted him up onto the couch.
Ready?
Good boy. He's able to maneuver himself. He rolls over with a lot more vigor than he used to. His stamina is better. Come on, let's go. Let's this way. We'll go this way. Yeah, the other night I took him across the street and he actually ran around the street. He didn't stop. I had to run to keep up with him, so that was pretty exciting to watch. He runs with Huck differently. It's been the most rewarding thing ever. He puts a smile on our face every day, and we wouldn't change a thing. Good boy. Oh, good boy.
For Pet Central, I'm Candace Batista.